Most of us are familiar with whiplash, and there's a pretty good chance that if you've had a sports injury, a fall, or a car accident, you've experienced whiplash personally. The fact that whiplash occurs so frequently is probably why it's one of the most undertreated conditions of the neck and back. And then combine that with our tendency to minimize or even ignore neck and back pain, as well as the sometimes inaccurate information we're often provided with in an urgent care setting, it's really no wonder why many of us decide to either attempt to treat whiplash on our own at home or to simply wait for the pain to hopefully go away. Now, unfortunately, whiplash is a serious issue that needs professional treatment. If it's left untreated or if we use an inadequate treatment approach, it can often be the catalyst for more serious issues down the road, including conditions such as arthritis, a bulged disc, or headaches. And if we happen to be one of the unlucky people that are involved in a trauma in the future, we're sadly at a greater risk of further injury. Now, before we get into the treatment of whiplash and how chiropractic can help, let's just take a minute to define it. Whiplash is caused by an abrupt backward and or forward jerking motion of the head. Now, this motion can result in damage to the neck, including the joints of the spine, the discs, the ligaments, the cervical muscles, and the nerve roots. Now, following an injury, those who experience whiplash may develop symptoms such as neck pain and stiffness, headaches, shoulder pain or pain between the shoulder blades, pain or numbness in the arm or hand, and dizziness or difficulty concentrating. Now, the whiplash treatment offered at Total Spine exemplifies the ideal approach to reducing whiplash symptoms, as well as allowing for optimal long-term health and healing. Our treatment addresses the wide variety of components that are often affected from a whiplash injury, and it's designed to reduce pain and discomfort, help patients restore their lifestyle, and to allow for the optimal end product when it comes to the healing of the injured tissues. So let's talk about some of the main chiropractic treatment options for whiplash injuries. Now, before treatment is provided and before treatment recommendations can be determined, it's important to assess a patient in their entirety. Now, where are they experiencing pain? Are they experiencing any restrictions in mobility? How did the injury occur? Are they experiencing any additional symptoms? Without a thorough exam and history, it's really difficult to determine where the symptoms are stemming from. And whiplash injuries, they may seem straightforward, but every whiplash case is unique. So there has to be a thorough examination of the muscles, vertebrae, and nerves of the neck and back in order to get an accurate diagnosis. Now, once the underlying injuries have been identified, that's when treatment can begin. Now, treatment is typically focused on improving mobility, relieving muscle tension and tightness, restoring the spine to its proper alignment, and supporting proper nerve communication and function. Now, as no surprise, the main tool and really the most important aspect of whiplash treatment in our office is the chiropractic adjustment. These adjustments, they can consist of short controlled thrusts or slower movements to help realign spinal joints and restore mobility. Joints are often misaligned and restricted as a result of a whiplash injury, and chiropractic adjustments aim to correct these restrictions and allow the joints to move properly. Therapeutic massage is another key component to effective whiplash treatment. Whiplash injuries often involve both a structural component and a soft tissue component, which includes the muscles, the tendons, the ligaments, and the discs. And in fact, this is quite often where the real healing needs to take place after an injury. Proper massage therapy treatment, along with proper chiropractic adjustments, will help alleviate pain, loosen tight muscles, and allow for proper function, mobility, and healing. Now, in-office therapeutic exercise also helps in patient recovery following a whiplash injury. Physical therapy like exercises and stretches can help strengthen weak muscles, improve mobility, and promote soft tissue pliability. And finally, there's at-home care. Now, this will typically include heat or ice therapy to improve blood flow or reduce inflammation, stretches to improve mobility and flexibility, strengthening to support damaged or unstable joints, rest, activity modification, and other treatments that a patient can incorporate on their own to help support the healing process. And really, through this multi-pronged treatment approach, chiropractors are able to help patients not only feel better, but to actually heal better, which will reduce the risk for additional pain and problems down the road. In fact, chiropractic has not only been shown to be very effective in addressing the initial whiplash symptoms, but it's also an effective approach to reducing long-term pain and mobility restrictions. And using our whole person, full body approach to treatment, we can restore optimal health and healing. So if you've experienced a whiplash injury, I encourage you to seek out the proper care. Without intervention, these injuries, which often seem minimal, can result in further injury, heightened dysfunction, and chronic pain. So that's all I have for you today. When it comes to whiplash injuries, please, it's just best not to fool around. We'll catch you guys all in our next video.